Hello, everybody. Welcome to the second webinar of PHEPREN, the new emergency research and response network from the WHO ethics group. My name is Jeffrey Kahn. I'm director of the Berman Institute of Bioethics at Johns Hopkins University. So welcome from here in Baltimore. Good morning from here. Good afternoon to those of you who are in Europe, and good evening to those of you who are in a time zone where it is later in the day. We have three speakers today who will be speaking about immunity passports. Are they inevitable? Are they ethically acceptable? How would they be? So I'll do a very brief introduction of the topic and then turn it over to our speakers, but let me introduce them first. Our first speaker will be Dr. Sylvie, who's director of the Global Infectious Hazard Preparedness section at the World Health Organization in Geneva. Our second speaker will be Professor Samia Hurst, who's professor of bioethics at Geneva University Medical School. And our third speaker will be Dr. Vu-Tek Chuan, who's at the Center for Biomedical Ethics at the U Lu Lin School of Medicine at the National University of Singapore. Thank you all for being with us. So the topic of today is immunity passports, which of course have gotten lots of attention in both policy circles and the media. And I think some of us who work in ethics and policy in response to the COVID outbreak have been starting to discuss this as well. And the idea, we'll hear much more about in a moment, but the idea being that those who have been infected and recovered from the coronavirus may have antibody titers that provide them immunity from reinfection. And if we were able to, first of all, test that and know that in fact they were protected and for how long, it may allow some people to go about business of their daily lives in the way that they did before without fear of infection. And it would have certain implications for civil liberties, for what we could reopen, what we could not, returning to school, returning to work, and so on. And so to talk about the issues raised by this idea, we have both some scientific expertise and then those who work on ethics and policy. And so with that, let me invite Dr. Briand to kick off today's discussion. I have one more thing to do, which is related to housekeeping, so hold one moment. Each of our speakers will speak for 10 minutes, and then we will open it up for discussion, which I will chair. I've been told that the best way for that to happen is for those who are attending the webinar to ask their questions via the chat function at the bottom of your screen. That way, everybody on the webinar can see the string of questions. This is the second webinar of the network of PHEPREN, and note that we are recording today and it will be uploaded in the coming days. It will be available on the network's website. The recording of the first webinar is also available, and there's a link on the website to that. So if you're interested in webinar number 1, please go there. If you're interested in further information on this topic or others related to ethics and the COVID-19 pandemic, there are now almost 500 ethics resources on the PHEPREN website. And I'm to announce as well that the WHO has formed a working group to consider the ethical issues around the COVID-19 outbreak in further detail. Lastly, I'm to say thank you to everybody for your interest in the network. The demand has been very high, and there's a hope to respond to everybody who's registered in the coming weeks to participate. All right, with that, let me invite Dr. Briand to kick us off this day. I was going to say this morning, but it's only morning for me. So, Dr. Briand.
Okay, thank you very much, Jeff. I will just give a brief update on what is the science behind and what we know about the immunity for COVID-19. And I apologize already because I will have to leave this call a little bit before the end because I'm heavily involved in the COVID-19 response here, and we have an urgent meeting that has been called this morning. And so that's why I'm sorry for that. It was not planned when we organized this webinar. So to start with immune response to COVID, in general, I mean, the immune response to viral infection has 2 steps. One step is called the innate immune response. That is really a response that kicks in for any kind of infections. And it's based on what we call innate immune response cells. And these cells secrete what has been interferon and cytokine chemicals that will interfere with the replication of the virus. And at this stage, with the innate immune response, you can clear the virus and get rid of the infection. And we think that this initial response is probably something that exists in COVID-19, and it's worth to explore because it's probably also what can explain probably some cases of asymptomatic infection or people with really very few symptoms. If the virus is not stopped at this stage of the innate immune response, then you have the adaptive immune response that kicks in. And this response is also based on cells, but we have two types of cells that are involved, the T cells and the B cells. And the B cells in particular are the ones who that are producing the antibodies that we call antibodies IgM and IgG. And these antibodies usually start to be produced around 8 to 15 days after the start of the disease. So this dynamic of the immune response explained also why serology testing can be negative at the beginning of the outbreak of the disease in one individual, because people at the beginning of the symptom have not yet developed the adaptive response. And so it comes only after that. So that's why we are not recommending serology testing for diagnostics, because at the beginning of the disease, it may be negative, but it's false negative because, of course, after some time, the people will develop this antibody response and the tests may become positive. So this is just to highlight a little bit what we know about COVID-19, because we have now seen some studies that show that people with mild disease tend to have also a lower adaptive response, meaning less antibodies than people who have severe disease. And therefore, the titer we will see may not be necessarily, and we don't know yet how much this antibody response is linked to the capacity of people to be immune to the disease. And there are still a lot of unknowns regarding those this immune response. The first one is really the efficacy of the immune response, because the antibody we can measure, we are not sure that these are neutralizing antibodies, which mean that really antibodies that impede the virus multiplication. And so the quality of the immune response, there are still some unknown about it. And we also have a lot of unknowns about the duration of this immunity. So what we can look at what we know about other coronaviruses, because COVID-19 is so new as a disease that, of course, it's very hard to know how long will the immunity persist, because so far we have only 4 months into this disease, so it's too early to know that. But when we look at other coronavirus, we see that the seasonal coronaviruses, the immunity is between 4 weeks, sorry, up to I think 48 weeks. So it's not very long. And part of it is because those viruses change a little bit. So it's maybe that we need to develop another type of immune response for a new, slightly new virus. But also it's because the immunity vanishes over time, and this immunity against seasonal coronavirus doesn't last very long. But the good news is that when you look at studies on SARS, which has been eradicated actually, or MERS, which is still circulating, and we have a little bit more experience on SARS and MERS, apparently the antibody can last a few years. So this is a good news, because it means that people are probably immune and protected for quite a longer time. So this is what we know about the virus and the immune response. Now we have some challenges related to the tests themselves. There are many tests that are available, and not all the tests are giving exactly the same results. And so there are also variability between different tests that are currently available. And so that's why also we have advocated for a little bit more time to assess the quality of those tests before really they are used to issue those passport, because depending on the type of test, we may not have really good results. And so this is one of the issue that we have warned a number of decision makers about. So then I just would like to quickly update you on what we have done for other diseases, because I think it's important also to factor in your conversation, because we have issued this kind of a certificate of recovery, for instance, for Ebola. It was not based on the symptoms, or it was not based on serology, sorry, but based on the recovery and the fact that people are recovered and don't have symptoms anymore. And it was very useful for Ebola patients to go back to their community, because of course there was a lot of stigma related to Ebola, and people, when coming to their community, very often people didn't want to touch them or didn't want to have them going back to work. And so it was a really very difficult, even for people who recovered, to go back to a normal life. So it has been very useful from the social point of view. We have also used those kind of certificates for instance, vaccination certificates for yellow fever, for people to travel from different places. So people coming from endemic places when they want to travel to some other places, but also for travelers going to endemic places, they need to have the vaccination certificate. And so this vaccination certificate was given not based on the antibody response, but really on just the fact that you have received the vaccine. So this is to show that it could be very useful from a social point of view, from a travel and trade point of view, or other use from the public health perspective. But still looking at what is the evidence behind, are these really protective or not, and what can we say when we have positive results, what can we say for the people. Regarding COVID-19, we fear that so first, the science behind those immunity passports is not really there. I think we would like really to have much more evidence about the quality of the antibody response and the quality of the test as well, and the duration of this response before being confident to issue such certificate. But we are also a bit concerned about the misuse of this kind of certificates, because we have seen in certain countries, for instance, for yellow fever, counterfeit certificates. We have seen also corruption linked to the issuance of such certificates, and also in other occasions, sort of stigma as well with this certificate. So of course, it doesn't mean that it will happen with COVID-19, but these are probably a consideration to factor in when we discuss the whole issue and when we try to embrace a comprehensive perspective. So that's it from my side. Thank you very much for your attention.
Thank you, Dr. Briand. Professor Hurst.
Thank you very much. So I'm here because I chair an ethics, legal and social issues group within the Swiss National COVID-19 Science Task Force. And we looked at the issue of immunity certificates or serology passports or licenses. They can go by different names. And we came to a rather skeptical conclusion about them, and I would like to outline why. But first, I would like to make 2 points. The first is that the whole thing, as we heard, kind of stands or falls on how certain the science is. It doesn't have to be completely certain, but it has to be sufficiently certain. How certain is it that if my test comes back positive, I actually have antibodies? And there are aspects with false positives, particularly in low prevalence areas, that are not entirely resolved. Then how certain is it that those who have antibodies are protected? How long does the protection last? So there's a whole science chapter that needs to be sufficiently robust so that we can make something of a positive antibody test. The second point I want to make in introduction is that there's a big difference between doing the test and giving the information back to individuals so that they can take it into account in the choices they make, and giving the test and then making the results something that gives you or withholds rights from you. It's completely different, and I'm going to talk only about the latter. Making the test available to individuals along with information that enables them to contextualize the result and to know what to make of it is something we are very much in favor of, but using this information for official documents is a completely different thing. So, and also I want to say our paper on serology passports is online along with all the other Swiss COVID-19 task force policy briefs. You can find it on Google very easily, or I can provide the link. Now, what can we say about the problems that remain once the science is cleared? So we're making the hypothesis that we can get there, that we can have sufficiently robust science to know that I am immune and I am protected against COVID-19 to have a positive antibody test. And in that case, then, would it be okay? So here are a few points that we need to consider in answering that question. The first one is that, that there would have to be something of limited duration, and we need to be able to guarantee that it's of limited duration, that we need to renew it if we're not sure how long immunity lasts, and that we can dispose of the data when the epidemic is over. There would need to be a legal basis. So of course you need to have the legal right to establish such a passport and a legal basis to explain how the process would have to be, what the appeals procedure would be, and so on. So a country that wants to implement this needs to equip itself with appropriate laws to protect the rights of individuals. But then we come to the hardest nut to crack, because any difference in rights needs a justification. So the first limit to this is that if we give different rights or different obligations or different privileges to people with and without such immunity certificates, of course, any difference in rights will have to be based on a risk that I might pose to others. Because if the risk is a risk to myself, then I should be informed and allowed to take it. I should have the means to protect myself, but not necessarily the obligation to protect myself. So we need to make this distinction from the get-go. Of course, there needs to be sufficient data protection, one hears in the literature, but when I say of course, it may be a little hasty, because actually, if you give different rights, duties, privileges to people with or without such documents, then your behavior starts to reflect immediately whether or not you have it. And so secrecy or confidentiality becomes a bit of a moot point. And so although there are technical solutions to keeping data private, if the data has an impact on your behavior in the public sphere, everybody will immediately know who has or does not have an immunity passport. But the most important difficulty is, will it be possible, and if so, how, to protect sufficiently equal rights when we have such different biological risks? And that's actually the central question from an ethical and legal and social point of view. It's a rather momentous question, actually. And I want to argue it's a rather momentous moment, because not being able to do what ordinary people can do because of a biological risk or a biological feature is kind of one of the definitions of disability. But the people who are non-immune to COVID-19 are currently the vast majority of humanity. And so we may find ourselves for the very first time, and perhaps the only time in our lifetimes, in front of the prospect that most of us could suddenly become disabled in the societies which we have built, supposedly for ourselves. Because this is what societies are for. So social organizations are our first prosthetics, if you will. They exist to enable us to exercise a certain number of rights and make certain choices, to live our lives, in short, in a way that does not compel us to risk our lives. We're allowed to risk them, but we shouldn't have to risk them in order to make choices and exercise our rights. Now, circumstances with COVID-19 are drastically changing. And all over the world, societies are reorganizing themselves more or less frantically in order to re-enable the exercise of rights and the making of choices by people while the epidemic is ongoing. Now, this is a lot of work. It's a lot of work and logistics and effort to reorganize societies in this way. And when we face this effort, serology passports kind of look like an easy way out. Okay, so you could keep everything as is and simply give the license to exercise the kind of social activities that everybody enjoyed in the past only to the immune. But it's not quite the way it should happen, is it? Because we may be facing several years of having to live with the epidemic, and simply putting most of the people's rights and choices on hold for the entirety of it does not seem like something optimal. We still need to define how to respect the rights of the immune and the non-immune in such a circumstance. In other words, if we go to the worst case scenario, we might end up with the society of the conscripted who are immune and have specific tasks assigned to them, and the disenfranchised, the non-immune who cannot do very much. And this, of course, could increase stigmatization, inequality. It could lessen solidarity because logics of them and us would become strengthened. There would be potentially infringements of human rights for everyone. I'm drawing a dark picture here. I'm not convinced that it would come to pass. But making this case, I'm very aware that different countries have different baselines, and countries will have different risk levels and reactions in facing such a deal. So we need, in fact, we need accommodations for the non-immune anyway. We need to be able to guarantee sufficient, at least, sufficient access to rights, to work, to equal regard, to the public sphere, to meaningful relationships, and so on. And these are not rights that are supposed to depend on biology. They cannot simply be abolished for the non-immune. Now, some might say, and some indeed have said, they're abolished now anyway, right? So might as well at least reinstate them for the immune. Now, this is true, granted, but it's not enough. And of course, we may be forgiven for not adapting everything immediately to give the possibility for all to exercise rights. But the longer the pandemic lasts, and the less these time constraints can serve as an excuse. The longer the pandemic lasts, the more it becomes false that we couldn't reorganize society to allow the exercise of rights for everyone. Also, the longer the pandemic lasts, the greater the infringement on rights for those for whom we have not made the re-exercise of these rights possible. And so I would argue, with or without serology passports, we still need to do this reorganization. And if we do, then a lot of the utility of serology passports would be lessened. They might become superfluous just as we make them more morally acceptable. So I would argue, in thinking how to implement immunity certificates, a lot happens around what we make of them, not simply making them, but what implications do they have in public and private lives for individuals. And of that, the biggest part of the work actually regards what we do to the rights of the non-immune rather than what we do to the rights of the immune. Thank you.
Thank you, Professor Hurst. Dr. Chuan.
Hi, thanks, Jeff. So I'm a member of the WHO COVID-19 ethics work group, and we are forming a team to sort of provide guidance on the ethics of immunity passports, or whatever you want to call them. But today's views are entirely my own, and I'm taking a rather pragmatic position. And I'm answering the question is, the question that I'm answering is, given that some societies or countries will push ahead with an immunity passport program, how then should they implement them in an ethical fashion? So like any other good policy making, you need to sort of assess, think about, or even imagine the likely or potential harms and benefits and sort of work out the trade-offs, right? But this is quite a challenging thing to do because of the scientific uncertainty, as the other two speakers have mentioned. So in the light of all these scientific uncertainties, one possible principle to apply is what bioethicists call the precautionary principle. So to put it in a very a simple manner is called a better be safe than to be sorry approach. So given that the scientific evidence is uncertain and the stakes are high, various sort of measures should be taken to sort of ascertain the necessary evidential level and also to prevent harm, right? So we know that the relationship between the antibody responses or levels and immunity protection is not that clear yet. So in order to minimize harm, prevent harm, various sort of reliable tests, clear standards and criteria for antibody thresholds, for example, needs to be set, right? And even if individuals are given these passports and are able to move more freely around societies, it doesn't necessarily mean that we sort of eliminate all the measures that we are doing now, right? So all the social distancing measures or control measures like temperature taking could still apply to these individuals, right? So that all depends on the necessity and the science. Now, we also know that, as the first speaker has mentioned, that immunity will wane, like a lot of coronavirus infections. So in light of this very strong possibility, that there should be a commitment to sort of retesting, right? So all these sort of measures are taken to sort of protect public health, right? And there should be some understanding that other than physical health, security, there are also other kind of less tangible unintended harms like stigma, right? So ironically, it's not usually infections stigma is attached to those who have been infected, but in this case, it's those who aren't infected yet, right? So it might actually apply to them. So given that there's a possibility of stigma, I think policymakers have an obligation to sort of minimize stigma and sort of ensure that it's not long-term or permanent. Now, in order to protect stigma, so you might want to think about various measures to protect the identity and privacy of those who have or do not have the immunity passports, right? In some countries like Singapore, so mask wearing is necessary for everyone who wants to go out, right? So if you allow people with immunity passports or certificates not to wear a mask, then anyone who wears a mask might be stigmatized because they be recognized as someone who does not have the immunological fitness, so to speak. So there's something to think about how to sort of mitigate all these sort of intangible harms and concerns. Now, I think the current sort of approach is to rely on, so instead of people wearing bands or wreaths or sort of physical things that are very visible to society at large, I think the current approach is to apply digital and blockchain technologies. So this will now link your verified test results with individual identity using QR codes or whatever sort of applications, right? So you move around society, you scan these codes, and know whether, and if you pass, you have the passport. If you don't, then you do not. But these are ways to sort of minimize privacy, and you can kind of minimize privacy concerns by sort of implementing the necessary legislation and regulations on use and abuse of these various sort of personal data. But of course, these sort of technologies might not be feasible or possible in other settings like low-income countries. So that's something to think about as we try to sort of enable the most people around the world to move out of severe social distancing measures. Now, in terms of benefits, I think Sylvie is right. There should be some sort of basic rights, right, that should be maintained that benefits everyone. So everyone should be able to go to grocery shopping, not to wear a mask, for example, in public because of the lack of evidence and things like that. So there should be a certain sort of baseline of equality and rights for everyone. But we do know that if you apply immunity passports, the benefits will likely be uneven or unequal, right? And some people imagine that we would, for those people with the immunity passports, they would be able to get back to as much as a normal life they had before the whole pandemic started. But this might not be possible for various reasons. So if you want to travel for holidays, it might not be allowed because of the lack of international agreement on the criteria for immunity passports, or people just might not be willing to take those risks, right? Even if they have been certified, right? The other sort of uneven reason for why benefits might be uneven is simply because of the lack of reliable tests or lack of access, lack of ability to pay and so forth. So currently, I think the standard is that the test need to be administered by a medical professional, and you need a lab to sort of confirm the test, right? So things need to move in a certain sort of way. Now, given that not everyone could, even if you want to do mass testing, that might not be feasible or possible, how then should you sort of coordinate all these sort of things to sort of maximize collective benefits for everyone? And by benefits, I don't just mean health, but also economic well-being, happiness, and so forth, right? And so what you might want to do is to sort of focus on particular sectors of society first. So maybe you could focus on those who are or willing to do essential work. So those in the so-called gig economy could volunteer to help out with pandemic efforts such as caregiving. You can focus on those who are most in need, such as migrant workers. So for those of you who have been following Singapore very closely, you know that every day for the past 2 or 3 weeks now, the majority of cases are migrant workers living in dorms, right? So these are people who have been sort of now, they were infected previously because they were living in very close quarters. So efforts now have been sort of allow them to live in better social spaces, right? But still they're not able to work. They usually are in debt. They need to remit their money back to their families and so forth. So allowing them back to work might sort of enable these vulnerable people to get back to some sort of well-being, right? And allowing them to do so might also promote instrumental value. So in Singapore, these workers, although they are transient and temporary, do prop up a significant portion of the economy by providing the basic infrastructure of the society, right? Now, I think there are also other potential benefits that, as far as I know, not many people are thinking about. So one way you can sort of increase benefits is to focus compensatory measures on those who are without the passport or certificates. So again, I can use the example of Singapore. So after the infection started to rise in Singapore, the government started to implement a lockdown and gave out a basic handout to everyone, whether you're rich or poor, working or not, right? Now, if you have a certain segment of the population who are able to go back to work because they were issued the immunity passports, then you can focus these payouts on these people who are not able to go back to work, right? And so their payouts, their compensation might be higher, right? So instead of sort of leveling down, what you're trying to do is level everyone up. And so this is to ensure a fairer distribution of benefits and burdens, right? So by focusing on those who are worse off or disadvantaged relative to the rest. Now, downstream, there might also be other benefits, right? Imagine that a vaccine is developed, but of course, even when a vaccine is developed, there might not be sufficient vaccines to go around. So what can you do? So you have people who really have been certified as having a certain amount of immunological protection, then you might want to focus the distribution of vaccines among the groups who do not have, right? So again, there are sort of benefits that could have, assuming that the immunity passport are based on a certain level of scientific evidence. So I think that's all I'm going to conclude now. So I think pragmatically, implementation should really focus on trying to secure collective benefits while trying to minimize harms to individuals, particular populations or society or as a whole. Or if you like, there should be management of 3 uns. So this uncertainty, how do you manage all this uncertainty of science? How do you mitigate unintended harms, right? And how do you manage the uneven or unequal benefits? And I think to conclude, I think it should really be emphasized that immunity passport is really a temporal or evolving strategy, right? To sort of help society transit out lockdown in the absence of a vaccine, right? So getting to a vaccine stage is still what must be strongly supported. And even as you allow a program of immunity passports implementation, the various sort of measures such as contact tracing, temperature taking might still be needed in order to ensure a safe transit out of lockdowns. Thank you.
Thank you, VT, and thank you again, Samia and Sylvie. I think Sylvie left, as she said she might need. Let me sort of put a little context in this and then open it to some of the questions. And we're getting a lot, so I'll do my best to group them to you both. Of course, all of this is happening in the context of our feeling increasing pressure. I think our leaders in government and in business are feeling a lot of pressure to figure out what to do to get us back to something like more normal life. And so, I think the context is important to point out. It's feeling a little bit like a desperate move very early on because we don't have good options. And so that's, I think, obvious, but I thought I would say it anyway. A couple of things to point out in terms of just the facts. I mean, there's a question of how long immunity would last. We can't ask Sylvie, but that's of course going to be important for what sort of time frame such passports might be issued for. And then somebody asked in the chat about whether we're sure that people who are immune can't transmit infection to those who are not immune, which of course would be important for us to know before sending people out into the world. Let me pose to you both something that I don't think either of you have talked about, but it relates to the notion of what is a passport. What does it mean to issue a passport? And whether we all walk around with passports as a means by which to prove our identity, but at least in the US, it's really more of an ability to travel, to cross borders. So you've both talked about issuance by governments and how that would work within a country. Certainly in Europe, where there's such a free flowing across borders, how would this work in the context of transnational movement, which is a sort of key aspect of what it means to issue and hold a passport? Or maybe it's just not the right language to be using passport, and it's something more like a license that's for local or state level use. What do you think about that, and what are the challenges of even thinking about it more like a travel document?
Do you want to go or should I?
Go ahead.
Okay.
Tell me you should go first.
So
I'll call you out.
Yeah, I think that's one of the packages of key questions, if you will. It's not about having what you do with it. It's about what doors does it open or close, and what doors are opened or closed if you do not have it. Now, all of this is up in the air, and it's very unlikely that if tomorrow 20 countries decided to implement such schemes, that they would come up with the same one. And the ethical assessment of the tool, immunity certificate or serology passport or license or whatever, very much depends on not the document itself, although everyone is focused on that, but on the circumstances in which it is deployed. Change to your life. Now, it's not problematic if there are some differences. What's problematic is if we rely on these passports to start up societies again, whilst forgetting that everyone still has the rights to sufficiently equal rights. So we then have to determine, is the difference that the passport makes something that touches on personal rights or not? So it's true that you give a good example, the example of traveling, right? So we have a right to mobility to some degree at least. How would it be implemented with and without such a document is one of the key questions. And of course, the situation is superior when you make accommodations to allow safe travel for everyone than if you say, okay, if you're not immune, you just wait it out. And if you are, then it's business as usual for you. And the same will apply for work, the same will apply for going out, the same will apply. And for work, I have to say, we're facing a recession. And it's not just about what governments do, it's about what private individuals do, it's about what employers do. It's about whether you're then requested to show your immunity certificate when you apply for a very scarce job in a falling economy. So this is very serious, this is about very serious matters that will impact people's biographies very deeply. So yes, the question is, how do we guarantee that a sufficient package of rights is guaranteed for the non-immune? And then if you do that, if you have to do that anyway, and this is, again, a majority of the world's population, a majority of every single country so far, if you have to do that, then having an immunity passport becomes less interesting because you would have access to a basic package of rights anyway as a non-immune person. This takes care of one problem, which is the fact that the non-immune might court infection in order to obtain a passport if it gives too many privileges. And that's another reason to not make the rights too different. However, there are still circumstances that are preferable. So the example you gave about focusing on the worse off and looking at how to distribute assistance. If you're going to be giving assistance anyway, then perhaps it's a good idea to certify immunity in these circumstances. But it all depends not on whether or not you're certifying immunity, but what you do with the results. And that's unknown for the time being.
PT, do you want to respond to this one, or should I pose a different question to you?
Yeah, I mean, the whole idea of conceptualizing immunity passports, I think there needs to be quite a strong rethink. I read a Guardian newspaper article today saying that the UK government is thinking about it, and they are unlikely to use the term immunity passport, right? So as you say, the passport suggests travel. A license suggests that you have been trained now to do something safely, but in effect, there's no training involved for people who are going to have immunity passports, right? You just got unlucky or lucky to have an infection. So lots of conceptual things are going on. I think at the end of the day, it's simply about a record that's tied to your identity. And as Samir says, it's really about what you're going to do about it, right? But how you're going to put in the necessary measures to protect those with and without the certificate.
So there are a number of questions, I think, around the same topic, which is, I'll paraphrase it. No matter what level of accommodations are crafted, created for those who are non-immune, there's likely to be incentive to be exposed and to be granted immunity, and therefore a license or a passport and all of the privileges that go with it. So can both of you say something about the social justice implications or the perverse incentives, however you would like to characterize them, sort of no matter what level of equal protection of rights, to use that kind of language, we attempt to place in society. Some will do better than others, but one imagines there will still be an incentive to expose oneself or to somehow be exposed to gain immunity. And for some that will be have low risk, and others that will be very, very risky. So thoughts about that? Maybe we start with VT this time.
Yeah, I think one of the main perverse incentive is for people to actually get themselves infected. So kind of like chickenpox parties, where parents expose their children to people with chickenpox in order to get them infected. So I think this is quite an unwise. So I think there are two sides to this, right? One is that, we know that certain populations, the young, the healthy, are probably going to get mild infections, right? So do they have the right to be naturally infected? Now, on the other hand, we know that even though they might have a stronger or less chance of being of developing severe disease, there's still a possibility, right? So in a situation where, or in a context of society where resources are overwhelmed, like intensive care resources, then do we want to sort of allow this? So if you have this sort of thought process, then you might want to sort of develop the necessary measures to prevent fraud, right? Or perverse incentives. So fraud can be sort of prevented by all these digital technologies, right? People falsely attaching a verified result to themselves, and perverse incentives can be mitigated by, I don't know, penalties if you're found out and things like that. So that may be more applicable in societies where there's a certain stronger sense of social or collective responsibility that everyone must abide by. And then if you fail those collective responsibilities, then you are liable for a certain sort of punishment. And of course, many other sort of measures can be taken. You can ask people to sort of testify or sort of sign a statutory declaration that they actually have a verified result and things like that. So these are sort of various measures we can to sort of deal with fraud and other sort of perverse incentives.
Samia.
There are other issues with the social justice aspects. I agree with many of the comments that were made. One is one that we actually made in our policy brief as well, that there is something paradoxical in punishing those who have complied with public health measures and who have dutifully remained out of harm's way in order to flatten the curve and keep our hospitals from overwhelm and so on, sometimes at great costs to themselves. And now they will be non-immune and disadvantaged in the next step of public health measures. This sends a complete counter message. It means basically it's in your interest now to go get the disease, and we're still trying to keep the curve under control and still trying to prevent our hospitals from being overwhelmed and so on. And so this is a problem. The other problem is by giving this message, it's a form of cutting loose of the ones who are sustaining the effort, or at least participating in sustaining the effort. And so this is one more risk to the already very important and already rather fragile notion of solidarity, which we need in facing a pandemic. So yes, there is a problem of social justice associated with it as well.
So I want to focus maybe on something we haven't heard as much about, which is the obligation side of the equation. So we've talked a lot about privileges and liberties, so sort of, right to move around in ways that would not be the case if you were not immune. But there are maybe obligations, and your comment about strong incentives to break quarantine. It's particularly true, I think, for people who can't do their jobs, can't make money. And in some parts of the world, that's huge. All parts of the world, really, huge parts of the population are suffering greatly, not just for social isolation, but financially, it's ruinous. And so, how would we think about the balance, not just of the kind of perverse incentives that you both have talked about, but if people were identified as having this positive trait of immunity, what level of conscription or obligation, I think you said conscription, Samia, might be required of them, both as a matter of what's acceptable, but also sort of where this goes, badly off the rails?
Yeah. So one obvious example that's been given all along, basically, is that it would be useful to have immunity certificates for healthcare providers in the front lines, because then they might be the ones to work in the COVID units, to intubate patients, to resuscitate them when they go into cardiac arrest, and perform generally all these very high-risk procedures during which healthcare providers can contract the disease, and some of them get sick and die. And so this, of course, also highlights how important it is to have the science sufficiently certain, because if you have circumstances in which when you have a positive test, you have a 50-50 chance of being immune, then sending you to the front lines, and perhaps also without personal protective equipment, because now we need to prioritize it to the non-immune, is basically sending you to your death on a whim. And on the off chance that the test was accurate in your case. And that, of course, is not acceptable. But yes, there might be duties associated with it. And again, this too is a question of distributive justice. How do we make, and perhaps rather than saying that there's conscription for the immune, it would be truer to say there's actually conscription for everyone. Because if you are immune, you might be conscripted to go do certain jobs that are placing yourself in the way of danger. If you are non-immune, you're conscripted to. And that's also something that you said at great cost to yourself, as you say. For many, it is ruinous, and so it might, as some said in the chat, it might play out very differently among different groups of society, where the incentives actually pan out. There are groups for whom it will certainly be a great advantage to be immune, others for whom it will be a great advantage to not be immune, and others for whom it will be a very fine line to tread.
BT, do you want to comment on that?
Yeah, I'm trying to organize my thoughts, and apologies if they don't come out as coherent. But essentially, I've been thinking a lot about the idea of collective responsibility, and you said is relationship with privileges and penalties, so to speak, right? So in Singapore, for example, there have been a lot of measures taken every day to ensure that we adhere to our collective responsibility. So I have to take my temperature twice a day. I have to wear a mask when I go out. If not, I might be either fined a substantial sum, or I might be put in jail, right? If I don't do all these sort of things. So it's the kind of measures that's being squeezing out of people's lives, right? And I read a white paper by the Edmund Safra Center for Ethics on when can we go out, evaluating policy paradigms for responding to COVID-19 threat. Now, if I understood that paper correctly, it's suggesting that certain conditions should be attached to having been certified as having an antibody response to coronavirus, right? So if you were to get a passport, you must be doing certain things, for example, helping out with pandemic efforts. So all these sort of things, I think, are pushing collective responsibility a bit too far, pushing solidarity a bit too far. So there should be, so even as I think about solidarity, this is when I think solidarity goes a bit too wrong, right? It becomes rather than sort of attachment to fellow citizens, now you're thinking as fellow citizens as potential threats. So this is my thought at present. So I'm not sure whether it's coherent.
No, it's very coherent. So among the things that we're starting to experience are those who have recovered and who have antibody titers are not granted passports, but are very valuable as convalescent plasma donors. So I'm thinking of other kinds of potential conscription as we work our way through as a sort of therapeutic option, right? So it's an interesting aspect that you, I think, pointed out, VT, that those who are infected are somehow more valuable, less stigmatized than those who are immune. It's the converse of our typical thought about stigma and disease. I want to ask you both about whether we need some sort of international guidance on this topic. And if so, or coordination, harmonization, if so, where should that come from, or where could that come from in order to manage some of these things which sound like they're not just related to one country, but of course they're global?
Okay.
Who wants to begin?
Will you go ahead? Okay, I'll go ahead. As you've realized, I'm very skeptical as to our ability to implement immunity certificates in an acceptable manner and still have them be useful, because I think the context would need to be changed to such a degree to make them acceptable that they might simply become pointless. However, I still believe that international guidance is crucial, because even if I think it's really hard to get right, and maybe it's not possible to get it right, there are vastly different degrees of how to get it wrong. And at the very least, I think we need to have some pointers as to the major mistakes to avoid. And I'm sure we can come up with the list that might sound like very basic stuff, but you would be amazed by the very basic stuff I have been reminding people of since this pandemic started in the clinic, in decision-making bodies, where things that seem to be obvious actually are very far from obvious. And this is just in one country. If you factor in the diversity of contexts and political systems across the globe, I think the need will be even greater to have a list of mistakes to avoid. The most egregious ones, at least, should be somewhere written down.
Right. So I'm just focusing on travel, right? So if you read RHR, the International Health Regulations, any sort of additional measures implemented, for example, in terms of travel restrictions. So using immunity passports in order to travel, you do need to base those additional measures as based on scientific principles, based on scientific evidence, and any advice or information from the WHO. So all these sort of things need to be coordinated and sort of agreed on, I think, at the international level. The IHR is a legal document, right? So there should be a more respect for that. So I think at the initial outset of the pandemic, a lot of restriction on travel were imposed, and I think there's been an argument that this is actually in violation of the IHR. So these are potential transnational or international documents that we can look at to ensure a certain sort of level of degree or standard in the way in which you want to implement immunity passports.
If I may add one more thing, a recent paper by Françoise Baylis and colleagues also pointed the fact that if immunity certificates or passports are done by different countries sort of piecemeal without some unifying baseline, then the risk is that the quality level would be extraordinarily different from country to country. The ease with which you might obtain a passport without actually being immune, i.e. simply pay for one, would also vary vastly. And so this would mean that in such an international system that did not have some rather strict and generally agreed upon quality control measures, then the countries where there was more corruption or less reliable labs would simply turn into the places from which the virus re-expands across the globe. And so for that reason as well, for the technical aspect, I think it's really crucial to have international guidance and to be able to point which, and so you'd also need a body to say which systems for immunity certificates meet or fail to meet these criteria.
Which starts to sound a lot like travel passports as you talk that way,
Exactly.
right? Which is an interesting parallel. We're back to that. So let me ask just one last question as we are getting close to the top of the hour. You sort of signaled this, but what do you both think the implications of this conversation are for lower resourced countries and regions of the world? It's you know, we're the three of us are sitting in places that are relatively well resourced, yeah. And we're struggling to how to think about this in our context. What happens in the vast parts of the world that are not as well resourced and are, you know, struggling with the public health implications, let alone something like immunity passport conversations?
Right. So I think there are two things to think about, right? If you are really subscribing to solidarity at a more global level. So if there are actually reliable tests that will come out, then the question is, how then do we ensure that these low resource countries will get access to this sort of test? So can there be some sort of global fund that pools funds together in order to make sure a fair distribution, right? Particularly in countries with many vulnerable populations. So that's one way in which I think there's something to think about, not just for immunity passports programs, but also vaccination programs if a vaccine was ever to be developed. The other thing is think about to sort of ensure that certain basic human rights are not violated. So we don't want, I think this is best done by imagining future scenarios that we don't want to go to. So we don't want to go to a future scenario in the countries where people are obligated to wear particular sort of marks on their sleeves or whatever to sort of indicate they are more safe than others, right? So that's the kind of world that we don't want. So a basic sort of standard of rights and equality should be sort of ensured for everyone.
Samia.
Yes, I think there have been very substantiated studies for a long time now showing how passports from different parts of the world actually do not give you the same mobility or the same access to different parts of the world or different rights. And this will probably map out along very similar lines where you will have less reliable testing, less access to testing. And so this will compound the effect of passports from various parts of the world giving you more or less access. As you say, we are sitting in very affluent parts of the world. I'm sitting in Switzerland, a country with many tests and very reliable labs. If I become immune, my passport will give me access to everything my Swiss passport gave me access to before, likely. But this is much less likely if I was sitting with the same immunity in a much poorer part of the world. The obstacles would simply be added up. I might have less access to testing. I might have access only to unreliable testing. And then if I did have access to testing and tested positive, the document that came out of it would be less trusted by other countries.
Thanks. I'm watching the clock, and I think maybe this is the right time to thank you both and to thank Sylvie, who's not here, but I'm sure that our thanks can be passed on to her. Thank you all for attending. It's been a great conversation. I think I need to remind everybody one more time that this is being recorded, and the recording will be available if you would like to listen to it again or share with others. The PHEPREN network is also accepting registrants, and I'm to remind everybody that the folks at WHO are working on revising to accommodate those who work in the field of bioethics but may not be affiliated with an academic institution to still be able to register. So with that, thank you both. Good to see you both. Thanks to everybody for joining and for your great questions, and tune in for the next webinar. Thanks all.